Hey guys, if you're watching this video, then chances are you're having testicle pain that's been going on for quite some time. Chances are you've probably gone to a urologist or some other healthcare doctor and they're not finding anything wrong. You've maybe had urine tests, you've had other testing, everything turns out fine. And for you, you're probably hoping that they find something. But again, nothing's coming up. And you've probably had a trial of some type of medication, perhaps some antibiotics, maybe other nerve medications, but nothing is really controlling this pain long term. So what else can this be? My name is Hina Sheth. I'm a pelvic floor and orthopedic physical therapist located at Rebalance Physical Therapy in Philadelphia, Pennsylvania. And I've actually done a TEDx talk on this exact same topic, and you can check out that link below or somewhere over here. So basically, this issue can be caused by a muscle, actually a group of muscles that are located deep inside of your pelvis called your pelvic floor. And how do I know this? Because I've been treating this for over 20 years, and we've seen a ton of this over the last 20 years of men suffering from this and actually getting pretty much pain-free from having this issue, sometimes for months to years. So I'm gonna kind of give you a brief idea of what's going on. And then in our next video, we go into full on in depth about what particularly could be causing this pain. So many other things that we go into about the psychological effects of how this can actually then tie into other muscle groups and so much more, and also how this can be treated and healed. So these groups of muscles are located deep inside of your pelvis. So this is the spine. These are the two pelvic bones. This is the pubic bone in the front. Now, if you look inside of this pelvis, there is a group of muscles in here. These are called your pelvic floor, and they consist of probably about 14 muscles in there that all function to actually keep your bladder, your bowels, and your sexual functioning intact and coordinated. And so any problems with these muscles can actually cause havoc in all of these areas. And particularly when these group of muscles are dysfunctional, they can contribute to testicular pain. And that pain doesn't necessarily go away because you go to the gym and do exercises, or work out your core, or even just do a general stretching program. They don't work that way. Now, these muscles work with a bunch of other muscles, yes, in and around the body. They work with your spine, they work with your abdomen, they work with your hip muscles, and all of them work together in a coordinated fashion to actually keep everything intact within the pelvic floor, as well as other things intact within the pelvic floor. And so if you're finding yourself going to the urologist, seeing other healthcare providers, and you're finding that this actually is not over time significantly improving with medications or antibiotics, then chances are this is a muscle issue. Now, what do you do about it? With the type of therapy that we do for this at our clinic, it requires a specific type of sequence to see that this improves over time and pretty much prevents it from hopefully coming back. And there could be a lot of different reasons why this may tend to come back, or why this may have happened in the first place. So in our next video, which is a full-on, in-depth, basically webinar that goes into all of this, you'll find those answers there, and you'll find out how you can treat this yourself as well. So I'll see you in the next video. If this video connected with you, please subscribe to our channel. We have lots of other great information. And if you live in and around the Philadelphia area, come check us out and see us in person. Take care. Have an awesome day.